You can't relax, you can't sleep, you can't breathe. You start to sweat, you tremble, and your muscles start to ache and tense. You're on edge, and there's no getting it to stop. According to a survey carried out by the National Health Service in 2007, cited by Daniel Freeman, a British psychologist, 66% of people with generalized anxiety disorder are not being treated. You may feel this way in stressful situations, such as having to give a speech or give an exam in class. For most people, it ends there, but for some, it doesn't. For others, it continues to persist. I was diagnosed with anxiety when I was 14 years old. Anxiety can affect anyone of any ages. This speech will focus on generalized anxiety disorder and provide information on what it is, statistics, diagnosis, and treatment options. So, what is anxiety? Anxiety is the most common mental health disorder. According to the Center for Addiction and Mental Health, anxiety is the irrational and excessive fear that brings tense, on-edge feelings and difficulty managing daily tasks. They also state that 1 in 4 adults develop an anxiety disorder sometime in their life. The knowledge of what anxiety is and helps in diagnosis and knowing what to look out for. The National Institute of Mental Health states that anxiety is diagnosed when a person worries excessively about everyday problems for at least 6 months. More than 40 million people worldwide are diagnosed with an anxiety disorder each year, with about 6.8 million of them being American. They are often accompanied by other anxiety disorders, depression, or substance abuse. People suffering from anxiety experience high levels of distress and restlessness in daily life, and people suffering from anxiety experience high levels of distress in daily life and restlessness when the day is over. Anxiety disorders can develop at any point in a person's life. About 3% of the population suffer from anxiety. Referencing Freeman again, 18% receive medication and 15% receive counseling or therapy. Now that you know what anxiety is and some statistics about it, how does one get diagnosed? A physician is the first person that can help determine if your symptoms are due to an anxiety disorder. If a disorder is detected, you will be sent to a mental health professional who will help you build a treatment plan. Treatment is fairly simple. It can depend on personal preferences. For example, cognitive behavioral therapy is often to be involved. They focus on teaching you specific skills to manage your worries and help you return to your regular daily life. Mayo Clinic states that possible questions to be expected from the doctor may include, what are your symptoms? Do you avoid anything because of your anxiety? And do your symptoms interfere with your daily activities? Medication can be used in addition to therapy. It is not a cure, but when used responsibly, it can help control your anxiety symptoms. Antidepressants, anti-anxiety drugs, and beta blockers are the most often used. Antidepressants change brain chemistry within the first dose and take 4 to 6 weeks for the symptoms to start fading. Anti-anxiety drugs are prescribed for a shorter period of time as people tend to build dependency for them. Beta blockers can prevent the physical symptoms of a feared situation when it can be predicted. Many people will benefit from a combination of both of them, and finding what works best may take some trial and error. In summary, anxiety is the excessive fear that brings nervousness and difficulty managing daily tasks. It can be felt by anyone. However, it can be treated, and with proper treatment, people with anxiety can live normal, fulfilling lives. Thank you for listening to my speech on anxiety. It has been a pleasure talking to you all today, but I'm afraid I'm about to have an anxiety attack, so I must go. Bye!